Hello, I'm Jane Collins. I'm the Chief Executive of Marie Curie, and I wanted to tell you a little bit about what I've been doing over the last few years. I originally was a paediatric neurologist and was Chief Executive of Great Ormond Street, but moved to Marie Curie 4 years ago and have been working hard to try to see how we can provide more care for more people across the United Kingdom. At Marie Curie, we look after people who are dying, and we also support their families. Partly through our hospices, we have 9 hospices across the UK, but also through our nursing services, providing care in the homes. And this is really valued by the people we care for. We'd like to be able to do more for more people. At the moment, we're looking after over 40,000 people, and our ambition is to get to 50,000. That's not just having a number plucked out of nowhere. It's because we recognise that more people are going to need the sort of care we provide. And as a national organisation, we feel we have a responsibility to contribute to meeting the increasing needs. There are increasing needs because of demographic changes. So the baby boomers, the so-called baby boomers, are obviously getting older at the same sort of time. And by the way, that means if you were born before 1964. So actually I'm a baby boomer. But we know that that age group, as I say, are getting older at the same time, which is increasing the need for the sort of care we provide as people reach the end phase of their lives. And as I said earlier, we want to be able to respond to that as much as we can, providing the sort of care and support they really need. So that's been one of our big ambitions of our strategy, and we have started to see increase in patient numbers, but perhaps not at the rate we would have liked, because there are some significant challenges we face. One of them is around ensuring that we can recruit enough staff. There's a national shortage and in fact a global shortage of nurses, and it can be a real problem having enough staff able to provide the sort of care that people and families can rightly expect. But we also have the challenge of a financial situation. We get some of our money from the NHS, and we all know that the NHS is under considerable pressure for funding. On the other side of our funding, we get money through our fundraising activities, our wonderful supporters who support our work financially. There are more problems with that perhaps now, and sadly there has been a fall off in trust of charities by people, the public across the United Kingdom. We hope that we can play a part in rebuilding that by being able to describe exactly what we do and the importance of our work, because we do need the combined NHS funding and the funding that our generous supporters give us to be able to then provide that care, which is so important for the people who need it. One of the things we also do is to make sure that we do as much as we can in other ways. The direct care, the hands-on care is what we're known for and what we're most proud of. But that's not to say that we don't do other things as well. So one of the building blocks of the current strategy was to provide an information and support service so that families, or indeed the person themselves, could contact the information and support service to find out what to expect. Let me just give a sort of example perhaps. Let's say you've gone to a clinic and you've seen the cancer specialist that morning. When you get home, you start to think, well, I think he was telling me that there probably aren't any more options for active treatment. What can I expect to come next? What do I need to plan? Do I need to make sure I've got a will written? Do I need to make sure that I've had the sort of conversations I want to with my families and friends? And that might be the person themselves doing that, or it might be his or his wife in the middle of a night waking up worrying about what was that doctor actually telling us? What do I need to do? What can I expect? And that's where the information and support service very much fits. But we also think that we ought to be looking at better ways of providing that sort of care. The interesting thing is how little money is spent on research into care of people who are reaching the end of their lives, people with palliative care needs, people who are in the terminal phase of their illness. And at Marie Curie, we're very proud of the funding we put into that, into research projects like how can one manage breathlessness better? How can one manage pain better, particularly in the home where it's really quite a challenge? And so those sorts of things we also fund and support. And then we also feel that we have a role and responsibility to talk on behalf of people in this sort of part of their lives. It's quite easy for policymakers and politicians to forget the importance of this phase of a person's life. When you think about the birth process, and then think about when one reaches the process of coming towards the end of one's life, there's quite a discrepancy, not only in terms, obviously, of how people are feeling about that. I absolutely recognise that one is joyous and one is obviously sad, but nonetheless, far less input in terms of resources is put into ensuring that people who reach the end of their life get the care that they need. There are some improvements. There have been some improvements made over the last years, but there is much more to do, or even now. And if I go back to that point about the demographic challenge with more people needing care, you'll see that we aren't really working from a set base. We're working from a situation where there is more need required, and yet we're currently not meeting the need that people have. We know that 1 in 4 people don't feel that they've had the help that they needed, for example. So you can see that there's a lot to be done. The thing that struck me when I first started at Marie Curie, and it still is something I hear, is the impact of a feeling in families and friends that their loved one didn't have the sort of death that they deserved or expected, or wasn't quite right. It might not have been in the right place, maybe they weren't able to get home. There are all sorts of factors which may play into that. And when that happens, the interesting thing is, but not surprising, is that I'm sure we all understand that, is that there's an enduring sense that perhaps it wasn't as good as it ought to be, and people feel that they let their loved one down. And I really feel as a national organisation we need to play our part to make sure that that happens as infrequently as possible. And I just want to finish by talking a little bit about the importance of our volunteers and our supporters. Without our wonderful thousands of volunteers working in fundraising, but also in our hospices and also in hospitals and through our Help a Volunteer scheme and our shops, we would not be able to do nearly as much work as we can do. We wouldn't be able to care for nearly as many people, to be frank. And the same goes for our supporters. Without generosity from supporters and their willingness to raise money for us at all times of the year, but particularly through the Great Daffodil Appeal, they play such an important part in enabling us to do the work. As I said earlier, we need the money from the NHS, but we really need the money also from the public to support the ongoing work that we need to do. So I'm very proud to lead Marie Curie, and I'd like to thank you for listening and hope you've enjoyed hearing about an update on where we are from me, and obviously look forward to making another film in due course to update you again. Thank you very much indeed for listening. Goodbye.